Hello, I'm Dr. Pribil. I'm a board-certified neurosurgeon. I specialize in diseases of the neck, mid-back, as well as the low back. I'm here to help you understand the symptoms you may be having after an automobile or a trucking accident or after a spontaneous disc rupture. One thing I like to do for my patients, their legal representatives and insurance companies, is to give them a video interpretation reading of the spine MRI and denote the problems that exist and see if there's any surgical intervention that might be helpful to alleviate the discomfort. I do this because the average individual does not understand the reading of an MRI, and I think it's very important that they understand these significant findings, how it causes their pain, and how it contributes to their neurological findings. This is an MRI of the cervical spine of a 71-year-old gentleman that car pulled out in front of him and he rammed into it in a T-bone fashion at about 55 miles an hour plus. He experienced sudden acceleration, deceleration forces. His head bobbed forward and back, hit the headrest, and he experienced a neck injury. So what we have here is we have a preservation of the normal curvature. His 7 cervical vertebrae, 1, 2, 3, 4, 5, 6, 7, and this is a T1, so you can immediately see evidence of some disc herniations here at the 5, 6, and 6, 7 level. Moving down to the 5, 6 level, however, this is where the real problem starts. There's a severe narrowing on the right side at that C5, 6 level, more so with a diffuse disc herniation that is compressing this anterior margin of the spinal cord, and it narrows the exiting nerve root. So I expect him to have symptoms in the C5, 6 area, namely in the wrist turning, twisting, and in the numbness along the base of thumb and base of index finger and the first web space. Typically, they also have decreased vibratory appreciation in this area. The fact that he also has disc herniation extending to the left side would make me believe that he would have some symptoms also to the left side. At the 6-7 level, you can see here that there is clearly a disc herniation in the foramen and some evidence of perhaps either cystic inflammatory changes or whatnot, but there's clearly a narrowing of this exiting nerve root on the left side, and you can see this disc herniation causing compression of these exiting nerve roots. There's maybe a little bit of a disc herniation alongside here, but most pronounced is this high signal, which is an indicator of a tear in the annulus and then disc herniation underneath that. So this individual, if he were to have symptoms that would be referable to the C5, 6 level and to the C6, 7 level, I would recommend a 2-level artificial disc replacement after all these places are cleaned out, after the disc is removed, and after these foraminal components of herniations are removed. Then I would place an artificial disc in at both. For those of patients who are out there who have been told that they need surgery and who have been contemplating surgery but are concerned, I can assure you that in the 37 years that I've done cervical surgeries and lumbar surgeries, I've perfected the techniques to really help patients, first with lumbar and cervical fusions many years ago, and more recently with the artificial disc replacement surgery in the neck, which is an extremely beneficial surgery for patients with neck pain, all in the outpatient setting. So we can do these surgeries now outside of the hospital in an ambulatory setting to help get you on your feet as soon as possible. To learn more about my practice, please go to drpribil.com. Thank you.